This 33-year-old patient, male patient, was referred to us for endodontic treatment of tooth number 30. According to the patient, who happens to be a dental phobic, who refused to be sedated, this tooth hurts so much that, to hot and cold, that if a drop of something cold or something hot hits the tooth would hurt for minutes after that. He said he had recently had his teeth cleaned, and even though he told the hygienist that this tooth was extremely sensitive to cold, some cold got to the tooth, and he said he was in tears. He literally was crying because of the severity of the pain. He tried to cope with this because of his dental anxiety for years, and finally he just couldn't take it anymore and talked to his dentist about it, and his dentist told him, hey, listen, if you want to get rid of your temperature sensitivity, you need to get a root canal. So that's how he ended up at my office. And the diagnosis, of course, for this tooth was irreversible pulpitis with acute apical periodontitis, which means when I tapped on the tooth was very tender to percussion. So again, we discussed options with him, but he just refused to be IV sedated. I think he was financial, understandable, and he asked me to please try it without sedation. And this is a hot tooth, as you guys know. So getting a hot tooth on a dental phobic patient, profoundly anesthetized, is a completely different ballgame. Anyways, so I said, fine, I'll do my best. Let's try it. And we went ahead and proceeded. So let's go ahead and take a look at the point of view clinical video of this tooth number 30, endodontic treatment from start to finish. All right. So let's go ahead and give our block. That's Lido, 2% with 1 to 100K epi. One of these. Make sure you aspirate. And then I'm going to follow it with Marcaine, 0.5% with 1 to 200K epi. And here's the Marcaine going in. Marcaine is long lasting, so definitely helps for these 1 hour endo appointments, and also for after the endo, gives the patient time to go home and start taking their pain meds before the local anesthetic wears off. Give things 10 minutes or so, and we'll come back. But here, of course, because it's a hot tooth, I fast forwarded, and I'm going to give, so I waited about 10 minutes, then I came back, I kind of fast forwarded. Now I'm giving septocaine here, 1 on the buccal, and I'm going to give 1 on the lingual aspect of the tooth as well. Remember, this is a hot tooth, and this patient has dental anxiety. All right, so let's give 1 on the lingual aspect of the tooth number 30 also. Very good. I'm going to fast forward again. All right, so next, my assistant is cold testing the tooth. to see if he feels anything. So that was my assistant using endo ice to cold test the tooth. And then she'll come back and report to me. Thumbs up or thumbs down. All right, it was a thumbs up. So he didn't feel the cold. So what do we do next? Rubber dam. No rubber dam, no root canal. Rubber dam goes on first. There are multiple different ways to put a rubber dam on. This is how I do it 99% of the time. Okay, with the clamp goes on the tooth first and then the rubber dam. So you do it your way. This is how I do it. My assistant to the left is suctioning, and then she's gonna wipe down the tooth, the rubber dam clamp, and the rubber dam around the tooth with 70% isopropyl alcohol. We like to keep everything nice and clean, and we're gonna go ahead and get started with a end cutting cylindrical diamond burr for our endo access. I don't use water, as you can see, but please, for heaven's sake, you use water. I know how to use my high speed without water and without frying the periodontal ligament. I don't care about the pulp tissue, but the PDL is important. So please use water when you're doing your endo access. And forgive me for not using water myself, because as I said, I know how to use my diamond burr properly and not fry the periodontal ligament. But you definitely need to use water. What you see here is the culmination of 24 years of experience. So I may make it look easy and you may not see the nuances, the small details of what I do, and want to replicate it when you really don't have much experience, and then you can cause all kinds of problems, complications. So please use water when you do your endo access. As I said, I know what I'm doing, and the way I do it, I make sure that it's not frying the periodontal ligament. Definitely use water when you do your endo access. Brushing with the diamond burr, not allowing the diamond burr to stay on the tooth for more than a couple of seconds, few seconds. My assistant to the right just blew some air in the tooth. All right, so let's go ahead and see where we are here with this tooth. And I constantly ask the patient, how are you doing? How are you doing? Are you feeling anything? So getting feedback from the patient gives me thumbs up, or if you feel something, I always tell the patient, raise your hand if you feel anything other than pressure and vibration. Just brushing with the diamond burr, as you can see. Brushing away the dentin. As you can see, I'm using a Zoomax microscope with a integrated 4K camera. I don't have it anymore. It was just a demo microscope. All right. If you have the money, I strongly recommend that you buy it. I just couldn't afford it. USA prices are 20 times more than what you might be able to get it in your country. Same exact microscope. Costs maybe what, 20? Maybe, yeah, 20 times, maybe 20 and more times. All right. So now I switch to my ultrasonic device, and this is just a scalar tip. Ultramin Pro, manufactured by 8 Teeth. The ultrasonic device, I strongly recommend it. And I'm just removing the roof of the pulp chamber with the ultrasonic unit. And again, this is just a scalar tip. But it works beautifully in these situations. Just unroofing the pulp chamber and getting into these canals. And there you go. You can see the pulp tissue already. There you go. I'm unroofing. I'm getting into kind of like a millimeter of the orifices of the canals. And I'm also going to soon be troughing for the middle mesial canal. On these lower molars, you definitely want to trough. They're there, the middle mesial. The middle mesial canal is equivalent for the lower molars, is equivalent to the MB2 of the upper molars. You need to trough for them. You need to locate them. All right. So there you go. There you go. Here it is. I'm using a spoon right now and pulling as much of the pulp tissue as I can. There you go. It's coming out. As you can see, this is now a partially necrotic tooth. You see? It's a partially necrotic tooth. You can see, you can tell from the look of the pulp tissue. It cleaned up really nice. All right, so now I'm going to my number 20 flare file attached to my reciprocating handpiece that I'm running at 1000 RPM with the torque off, and I'm just pulling out as much of the pulp tissue, this partially necrotic pulp tissue, as I can. And also flaring the coronal part of the canals, or allowing this number 20 flare file, which is a stainless steel file with a, I believe, 4 or 5% taper, allowing it to go as far as it wants to go. And then you can see I'm using it in a brushing motion, pulling out as much of the pulp tissue, this partially necrotic pulp tissue, as I can. All right, here you go. And my assistant to the left, she has the suction there to just get all these debris suction out of the tooth. And here it is. That's what we have right now. All right. So let's see what I'm going to do next. I'm watching this video with you guys. I haven't watched it before. This video is from March of this year. All right, here we go. So now I'm using the same scalar tip attached to my Ultramin Pro ultrasonic unit. That device, ultrasonic device manufactured by 8 Teeth, has a container, and I filled it with 2% hypo. So now I'm just irrigating the pulp chamber and the canals with 2% hypo, and look what it did. Look how beautifully it cleaned the pulp chamber for me. My assistant cleaned my mirror, and now I'm going to 6% hypo here. I used 2% hypo in the Ultramin Pro ultrasonic unit manufactured by 8 Teeth because the 6% hypo will destroy it. The 2% hypo is more forgiving. All right. So what I have here, I have my 08C file attached to my M4 reciprocating handpiece that I'm running at 1000 RPM with torque off. And I'm going to scout the canals with it. Scout the canals with it, up and down in a brushing motion, and also scouting the canals with it. When you run this reciprocating handpiece at 1000 RPM with the torque off, you're not only instrumenting and shaping the canals with these files, you're also sonically activating the 6% hypo. That's the great thing about this device. All right. It seems like we should be able to get a apex locator reading here. All right, I'm using the FinePEX apex locator by 8 teeth here to get the measurements, working length measurements. That is in the MB canal, mesiobuccal canal. All right, here we go. I'll give it to my assistant, and my assistant will read it. It looks like it was 20, maybe 21. All right. Looks like I need a little bit more instrumenting here. So I'm filling the pulp chamber and the canals with 6% hypo again. And yep, I'm going with a, what is this? A 10 C file to 21 millimeters. And look, I was scouting and I found the middle mesial canal right there. Right now, I'm in the middle mesial canal. There you go. You can see it. This is a 10C file, as you can see, purple handle. Just a stainless steel C file, number 10. And I immediately located the middle mesial canal. I'm running this handpiece, the M4 safety handpiece, reciprocating handpiece at 1000 RPM with the torque off. I'm not only instrumenting the canals with it, I'm also sonically activating the 6% hypo. And I just located a middle mesial canal. I'm brushing and up and down, as you can see. Just pay attention to the movement of the handpiece. There you go, up and down, activating the 6% hypo and brushing the canal walls with it. All right, very good. 21 millimeters. All right, mesiobuccal canal here. Mesiolingual canal, 21 millimeters. Up and down, brushing motion, activating the 6% hypo. Sonically, up and down, brushing away from the furcation. Looks like I'm in the distal canals right now. Up and down, brushing motion. All right, let's go ahead and irrigate again. As you can see, I switched to thinner, the yellow irrigation tip and 6% hypo. The blue one, I think the blue one is 27 gauge and the yellow one is 30 gauge. All right. Okay, number 15 C file. I'm in the middle mesial canal, going to 21 millimeters with a number 15 C file, up and down, brushing motion, activating the 6% hyposonically. Up and down, mesiobuccal, up and down, brushing motion away from the furcation. Mesiolingual, same, up and down, brushing motion, as you can see, not forcing the file, just allowing it to go where it wants to go, up and down, activating the 6% hypo. Up and down, activating the 6% hyposonically, going into the distal canals, up and down, brushing motion. No forcing the file or files. All right, let's go ahead and irrigate again. 6% hypo. Just copious amounts of 6% hypo is used throughout the procedure. All right, what do we have here? We have the easy shaper files. Right now that I'm using these files, easy shaper files. They're excellent files, and I'm using the first file. It's a number 15. Variable taper, 3 to 6% taper. All right. That's what I'm using right now in the mesial canals, the 3 mesial canals going to 21 millimeters. As you can see, up and down, and brushing motion. Up and down, brushing motion. Not forcing the file, but remember, I had already created a glide path to a size 15, but my size 15 is different. It's not a 2% taper. Remember, I also used a 4% taper or 5% taper flare file, right? So I have a very good glide path to my working length before I put that NiTi file in the canals. All right, I went to the next file of the series, and again, brushing motion. So these are the files, easy shaper. They're excellent files, really, really good files. Look how much dentin we removed. Up and down, not letting the file bind. That's when they break. Also, remember, again, I'm emphasizing that I had already created a nice glide path. When I tell you guys brush, so that means that you can use your 2%, these stainless steel K files, C files that I use. When you brush with them, you basically, what you do is you don't end up with 2% taper of the file. You end up with 3 or 4% because you're brushing with these files. All right, so 6% hypo. Copious amounts of 6% hypo, as you can see, throughout the procedure, after each file. Leaving hypo in the pulp chamber and the canals, of course, you can see. The pulp chamber is full of hypo, filled with 6% hypo. All right, I'm cone fitting up and down with the gutta percha cone too. That's another way of, poor man's way of activating the 6% hypo. Remember, throughout the procedure, when I was using my M4 safety reciprocating handpiece, I was also activating the hypo sonically. Remember that. I'm making my own custom master gutta percha cones. I'm just using, right now it's a number 20. You can see I'm in the middle mesial canal right there. So I let it go as much as he wants to go, and then measure it. And if it's more than 21 millimeters, I just cut the tip. And I end up with my own custom master gutta percha cone. All right, mesiolingual, same. Up and down, activating the 6% hypo. There you go. Measure. If it's more than 21 millimeters, I cut the tip accordingly until it shows 21 millimeters on my ruler. My assistant is just using the microsuction to suction around the tooth. And then she's going to wipe it down with 70% isopropyl alcohol before she gives it to me to suction the inside of the tooth, of course. She's not going to give me the same tip. Remember, we don't want any cross-contamination. All right, let's go ahead and irrigate some more. All right, let's use the microsuction, and you saw there was some bleeding from the mesial canals. It's okay. That happens sometimes. It's not a big deal. This is not a hypo accident or anything like that. You know, when you get a hypo accident when you pressurize sodium hypochlorite under pressure out of the canal into the periapical area. Patient will jump from massive pain. This is just passive sonic activation of the 6% hypo can sometimes cause some bleeding. This is not considered a hypo accident. Remember, a hypo accident is when you express the sodium hypochlorite under extreme pressure out of the canal. It causes severe pain to the patient immediately. The patient could be profoundly anesthetized, local anesthetic. The tooth could be profoundly anesthetized. Patient will still feel it. All right, so I'm getting some bleeding from the mesiolingual canal there. I'm drawing the distals right now. You can see the 3 mesial canals right there. All right, so I'm gonna leave that sterile paper point in the mesiolingual canal, the canal that was bleeding, and I'm just gonna focus right now on the mesiobuccal, obturating the mesiobuccal. Right? So leaving the sterile paper point in the mesiolingual canal is just like putting pressure on a bleeding wound. You keep pressure on it, and the bleeding will stop. Same thing with that. I'm just leaving the sterile paper point in the mesiolingual canal, and I'm obturating the mesiobuccal and middle mesial canals right now. All right. So this is a System B heating unit. I'm cutting the coronal part of the master gutta percha cone and thermoplasticizing the rest. I'm using a number 2 Buchanan plugger, applying apical pressure to the thermoplasticized gutta percha. As you can see, Let's do the distals now. There you go. These are number 25s. Okay, 3 distal canals. So this tooth had a total of 6 canals. Some of these canals joined, but that distal was kind of ribbon shaped. So you had all kinds of canals, but they all joined. You'll see. All right, so use system B to remove the coronal part of the gutta percha and thermoplasticize the remaining, and then I'm using my number 2 Buchanan plugger. I'm using AH plus sealer. You keep asking me what kind of sealer I'm using. I only have AH plus. I don't have a specific sealer for a specific situation. I either use AH plus sealer, or if I'm obturating with anything other than gutta percha and AH plus sealer, then I'm obturating probably with MTA. And if I'm obturating with MTA, part of the canal, I'm obturating with MTA, probably the apical part of the canal. And then the rest of the canal, I obturate with AH plus sealer and gutta percha. All right, so I removed the paper point from the mesiolingual canal, right? I'm going to make sure, I'm going to see if the mesiolingual canal is bleeding. Yes, it's bleeding, still bleeding. And remember, this is real endo. This is not edited. I'm watching this with you for the first time. What do I have on that sterile paper point right now? I have Cutrol. Cutrol. Cutrol is a hemostatic agent. And I dipped my sterile paper point in it, and I placed it in that bleeding mesiolingual canal. And I'm going to do it again. Cutrol in the mesiolingual canals. Look, it almost completely stopped the bleeding. I'm going to try again. If it's bleeding, I'm not going to obturate. I'm not going to obturate when it's bleeding. And look what I'm doing next. I'm irrigating with 6% hypo right now. I don't want to leave any blood in the canal. I'm not gonna leave any microorganisms, any food for microorganisms. Microsuction, and it looks like it's still bleeding. This is real endo, unedited. This is when you learn stuff, when you see kind of complications like this. If I only showed you the endo that went perfectly fine with no complications, what are you going to learn? You're not going to learn anything. I want to show you this stuff. So if you encounter a situation like this, you know how to do it. Some clinicians, they only post their perfect cases, best perfect cases. Everything goes by the book perfectly. I mean, it's valuable, those cases too. You learn from them, but the cases that cause some kind of complication like that is when you learn the most, because very likely you will encounter the same thing at some point. And now, after you watching this video and seeing how I'm stopping the bleeding, then you know how to do it too. There you go. No more bleeding. The bleeding stopped just like that. Just like that. The bleeding stopped. All right. Now I'm introducing AH plus sealer on a sterile paper point. And I'm going to obturate that mesiolingual canal. Didn't leave any blood in there. Irrigated it with hypo. After the bleeding stopped, confirmed that the bleeding had stopped with a sterile paper point, and there was no bleeding, and there you go. System B, removing the coronal part of the master gutta-percha cone, thermoplasticizing the rest, and number 2, Buchanan plugger to condense the gutta-percha. Very good. Let's go ahead and I asked my assistant to dry it. Make sure that I didn't miss any anatomy. I'm constantly checking. Sometimes you find something that you may have missed, another canal, another complexity. You never know. You never know. All right, so I'm using my Obtura 3 Max gun and injecting thermoplasticized gutta-percha to obturate the remainder of the canals, as you can see here. And again, using my Buchanan plugger, number 2, to condense the gutta-percha further. So my phone right now is showing that I'm 37 minutes in, and I fast forwarded a little bit. So we're probably at the 42 millimeter mark right now. So we were able to basically do this root canal in under 1 hour on this patient with dental phobia on a hot tooth. Very comfortably. Patient did very well. Handled it very well, but handled it well because I made sure that he was profoundly anesthetized. Profoundly anesthetized, okay? This is 70% isopropyl alcohol to clean the pulp chamber and pulp chamber walls. Make sure everything is nice and clean. Dry it. And sterile sponge goes in, followed by cavet. And then we'll send the patient back to his dentist for the permanent restoration. Sterile sponge goes in, cavet goes in, there you go. Cavet goes in. All right, that's it. Rubber dam comes out, and my assistants are gonna clean him up and take some radiographs. So let's go ahead and take a look at the final radiograph and see what we accomplished. We did, again, this root canal in under 1 hour. So my timer right now shows, and I remember fast forwarding, my timer is right now is in 40 minutes. So I fast forwarded about five minutes of the video. So we were able to complete this root canal in 45 minutes. So 45 minutes, let's call it under 1 hour, all right, on a dental phobic patient with a hot tooth. So let's go ahead and look at the post-op. Here's the post-op, one angulation. So you can see the 3 mesial canals. Look at that beautiful lateral right there. 3 mesial canals. The mesiobuccal and middle mesial joint, and that was the mesiolingual that was bleeding. And then you can see the 2 distal canals there, that joint. Or I put 3 or 4 gutta-percha cones in there because so you can see how wide this distal canal is. And that's another angulation. Look at that conservative endoaxis, straight line into the canals. As you can see, everything went beautifully here. Patient did really well. We were able to do this root canal in 45 minutes and get this patient out of pain and out of our office in good health. He didn't feel anything. He didn't suffer. We adhered to the fundamentals of endodontics. And this is the outcome. So I hope this video, point of view video, clinical video from A to Z helped you guys. And please make sure you subscribe. You've already subscribed to my channel. I see a lot of people watch my videos and they haven't even subscribed. I mean, that's the least you can do. Make sure you like, make sure you make a comment, make sure you share the videos. I'm doing it for free. As you can see, these videos, they're not getting monetized. And monetized, like what? I'm making 30 cents on the video. It's ridiculous. I'm basically doing it out of the goodness of my heart, and I really want to pass all the knowledge of 24 years of knowledge that I've accumulated. I don't want to take it to my grave. So I want to pass it on to you guys. So make sure you at least appreciate it. Make sure you subscribe to my channel. Make sure you like the videos. Make sure you make a comment. Make sure you share my videos with your friends and colleagues and classmates. These videos are also very good. If you have your dental assistants watch them, your hygienist watch them. The more educated your dental assistant is, the more educated your hygienist is, the better off you are. They make you look good. So also make sure your dental assistants and hygienists subscribe to my channel and watch these videos and make comments and like them and share them with their friends and colleagues. All right. So anyways, excellent. Very good. And you have any questions, put it in the comments section, and see you guys in the next video. And these are the files that I used. You can purchase them from flexivodental.com or go to Instagram and contact at flexivodental. And the guy is very good. He is located in Los Angeles, California, and he is very responsive. He responds to your DMs very quickly. This is the apex locator that I use, 8 teeth. It's called FinePex. Let me turn it. FinePex apex locator by 8 teeth. Very good apex locator. And this is the Ultraman Pro ultrasonic unit by 8 Teeth. Strongly recommended. This the blue handpiece is for endo, and the silver one is for the rest. It does restorative work for you. It does perio and endo. And this is the container that I fill with 2% hypo. Right now, it has saline in it. And it comes with all kinds of tips that you can purchase. If you just go to 8 Teeth's website, and all these tips and when they should be used, what are their indications, and all the information regarding this unit is on 8 Teeth's website. And of course, the microscope that I use is the global microscope, and I usually use it at the 0.8 setting. For the case that you saw today, I had the Zoomax. It was a loaner microscope, and if you have the money, you can buy it. It's got that integrated 4K camera in it. I don't have it anymore, unfortunately. As I said, it was a loaner. So, but it basically records everything. You can record your procedure. You can take photos. Great microscope. It's just too expensive here in the United States. Some colleagues reached out to me and told me that they can buy the same microscope that was offered to me at the cost of a, I don't know, brand new car. They can buy it in their country for 1/10 of the price. My Obtura gun, Obtura 3 Max, and the System B heating unit right here, and that's the tip of it. That's the handle of it, System B, right there. My M4 reciprocating handpiece, right here. It takes regular K files. These are all K files that go into this M4 reciprocating handpiece. So it's attached to this Dentsply Tulsa Dental electric motor. All right. Very good. I have basically the same exact thing in this room. The same setup, microscope, and everything else. These are my handheld X-ray guns. And my digital X-ray system is Schick 33. Schick 33 by Sirona. Schick 33. All right. Okay. My endo setup right here is ready for my first patient today. This is all 6% hypo, and my final rinse is with 70% isopropyl alcohol. All right. This is the cut roll that I used today. To stop the bleeding from the mesiolingual canal. That's the name of the company. You can call 1-800-CUT-ROLL and buy this. 1-800-CUT-ROLL. Cut-Roll. All right. I believe it's a 30% solution of ferric sulfate. All right. Very good. See you guys. See you guys in the next video. Bye-bye.